The secret of making progress is to get started. Ladies and gentlemen, a pleasant day to you all. We are the Group 4B of BSN3C presenting a research entitled Factors Influencing Nursing Students' Academic Performance in Blended Learning Modality. I am Barbara Ali Zamora. Together with me are Angelica Tabacug, Jillian Belle Taquiso, Aileen Grace Tortal, and Anica Martina Vazquez. The Higher Education Unit integrates multiple learning modes into the new normal to encourage students to perform better in achieving academic needs. Academic failure among nursing students is currently a subject of significant international interest due to its economic cost and negative impacts on the availability of future nurses in various healthcare systems, following an abrupt transition from an online learning environment to blended learning setting. With this being said, the study aimed to determine the factors influencing the academic performance of nursing students in the blended learning modality.
This research utilized a quantitative correlational research design, ideal for efficiently gathering data from natural settings, utilized to determine the strength of the relationship between the study variables. In this study, the survey method was utilized. A survey method is a procedure, instrument, or technique that can be used to interview a predetermined group of people in order to collect data for the study.
The target participants of the study were undergraduates of all levels in the College of Nursing from a local university in Bacolod City, who were enrolled in the second semester of the academic year 2022 to 2023. The overall population consisted of 961 students, and out of this population, the researchers were able to calculate the sample size using the Rausow's formula and computed based on a 95% confidence level and a 5% margin of error. The study sample, as determined, consisted of 277 nursing students, and they were chosen using a stratified random sampling method that divided each year level.
This study utilized a researcher-made instrument composed of two parts. The first part contains the demographical data of the participants, and the second are questions regarding the factors that affect the academic performance of nursing students in the blended learning modality. It was mainly based on previous studies on factors affecting the academic performance of student nurses. The questionnaires' validity was assessed using the Good and Skates validity test, resulting in a combined final validity score of 4.80, indicating an excellent validity. To measure reliability, Cronbach's alpha test yielded a score of 0.836, indicating satisfactory reliability.
Next is our results and discussions. First, the demographic profile of the study participants. Among 277 students, 74.7% are female and 25.3% are male nursing students. The smallest group is from level 1 with 21.3%, and the highest number of participants is from level 4 with 28.2%. More than half of the participants have stable internet connectivity and a laptop or desktop with 52.7%, while 29.2% are from rural areas, and the majority of the participants have a very good general weighted average, with 58.8%. The general weighted average is a significant factor in predicting academic performance and may affect completion of the studies within the expected timeline.
The bar graphs presents the factors influencing nursing students' academic performance, including individual characteristics, parental expectations and guidance, school facilities, recipient of teaching strategies, learning environment, and overall assessment. The mean score as a whole is 3.93, indicating that participants rated the factors highly. This suggests the students receive adequate resources, effective teaching methods, and a conducive learning environment. Overall, indicating a satisfactory nursing education program that meets the needs and expectations of its students. These findings highlight the importance of these factors in supporting nursing students' academic performance and overall educational experience.
For the relationship between the factors influencing nursing students' academic performance and profile variables, the results reveal that sex, connectivity status, type of community, and general weighted average does not have significant relationship. However, there is a significant relationship between the factors influencing nursing students' academic performance in the blended learning modality and year level, with a value of 14.545, p-value of 0.024, CV of 0.163. Therefore, the null hypothesis is rejected at the 5% level of significance.
In this study, 277 participants were involved, with the majority being females. In terms of the demographic profile, results reveal that year level was a significant factor that affected a student's performance in the blended learning modality, while no significant relationship was found between the other variables, and the null hypothesis was not rejected at 5% level of significance. As it was discovered that year level was a factor that affected a student's performance, it entails the rejection of the null hypothesis, which implies that year level was a predominant factor that made an impact on the academic performance of the students. Based on these results, the researchers had observed that with an increasing year level also concurrently comes the increase in standards and expectations placed on the students, and the possible lack of exposure to clinical settings due to a blended learning approach results in the lack of opportunities for students to enhance skills for learning compared to those in a full face-to-face setting. On the other hand, in terms of specific factors such as individual characteristics, parental expectations and guidance, school, recipient of teaching strategies, and learning environment, all these factors garnered results of high verbal interpretation with regards to mean and standard deviation, which indicated that these factors all greatly affect a student's performance in school. The conclusions made from this study push for the emphasis on the importance of discovering how certain factors directly affect a student's performance in school but in the blended learning modality. It was therefore inferred that different approaches may be applied to make a student's learning more conducive in both settings of blended learning, as all the factors mentioned are critical to a student's learning and academic performance, which will become the foundation of a student nurse on the path to becoming a professional in the future.
Thus, the researchers recommend that the university may utilize this result to conduct periodic evaluations, ensuring that the nursing education program meets the needs of students and industry standards. The College of Nursing Administration may focus on providing comprehensive student support services, including academic advising, career counseling, and mental health services. Clinical instructors may give constructive feedback to nursing students, encouraging reflective practice and highlighting strengths and areas for improvement. Nursing students may actively engage in their learning and seek support from instructors and peers. Future researchers can expand sample sizes to collect more meaningful findings.
To access the references of the study, you may scan the QR code on our poster. Moreover, the group expresses gratitude to the individuals who provided great support and contributed to the accomplishment of this research study.
That would be all for our research study entitled Factors Influencing Nursing Students' Academic Performance in the Blended Learning Modality. Thanks for watching, and once again, we are BSN 3C Group 4B. Animo Lasal.